Okay, let's talk about X-linked recessive disorders. Remember, these diseases most commonly affect males who always inherit it from their mother. You can identify these in a family tree using the process of elimination. So for this tree, you can tell it can't be autosomal dominant or X-linked dominant since you don't see it in all generations. And it's not mitochondrial since nobody's getting it from their mother. So it could technically be either autosomal recessive or X-linked recessive, but this one's more likely to be X-linked recessive. First of all, autosomal recessive diseases you will almost never see in more than one generation, since at least for the sake of the test, you should assume that it's rare in the population, so the odds of both grandparents being carriers and this other male being a carrier are almost non-existent. It's a lot more likely that there's only one disease allele, which is getting passed from person to person. What's going on here is that the grandmother in this family is a carrier for an X-linked recessive disease. So she doesn't have the disease, but she can pass it on to her son. And he will be affected since he has no normal copy to make up for it, like his sister does, over here. And then she can pass it on to her son the exact same way. In your book, you have a list of the most common X-linked recessive disorders and a nice mnemonic you can use to remember them.